multiple pigmented lesions on the gingiva. 26-year-old white male who referred to surgery department for evaluation of multiple pigmented lesions on the left anterior mandibular labial gingiva. History of a present illness. This lesion had been there for 3 years and had been observed by his dentist. Patient was concerned and he believed it had been growing, saying it was 20 times bigger. He reported very mild pain in the area, may or may not have been related to the pigmented lesion. Medical history. No medical conditions or allergies were reported, but he reported consuming alcohol 2 to 3 times per week and smoking 3 to 4 cigarettes per day. Clinical finding. Multiple well-demarcated dark brown macules. The largest is about 1 mm in diameter. There is no evidence of swelling. Incisional biopsy was taken. It revealed large and atypical melanocytes were arranged in small clusters. Here, showing how the gingiva with a cluster of malignant melanocytes. Specific antibodies that stain malignant melanoma cell. So, what's the differential diagnosis? Differential diagnoses include macules, malignant melanoma, amalgam tattoo, smoker melanosis, Addison disease. First, we will start with macules. Macules usually present as oval-shaped brown and flat lesions less than 5 mm, most commonly on lower lip, then gingiva, followed by buccal mucosa. In histological section, in focal areas, the basal cell layer produce and release melanin. So, any clinical presentation in this case can be melanotic macules, but the histology doesn't support this diagnosis. Second, amalgam tattoo. Amalgam tattoo, local deposition, metallic material from dental fillings, mostly from amalgam. It deposited in collagen fiber in connective tissue around small blood vessels. Most common occur on the alveolar mucosa, buccal mucosa, and gingiva. Histological section present as a granular plaque material deposited on the surrounding thin collagen fibers. So, the clinical presentation and the histology for this case are not supportive of this diagnosis. Smokers' melanosis. Smoking-related melanin production produces a flat light brown pigments, usually diffuse, present on the labial anterior gingiva. It occurs on the mandible more than maxilla in heavy cigarette smokers. The histology consists mostly of excessive melanin production arranged in small clusters, so neither the clinical presentation nor the histology is supportive of this diagnosis. Addison's disease. It's an endocrine disorder. It's characterized by muscle weakness, fatigability, vomiting, weight loss, hypotension, and present with the skin and mucosal darkening. Neither the clinical presentation, nor the medical history, nor the histology of this case are supportive of Addison disease. Malignant melanoma may on skin or in oral cavity. Mucosal melanomas are very rare, but more aggressive in behavior than those of the skin. We should know that malignant melanoma is the third most common skin epithelial malignancy, following basal cell carcinoma and squamous cell carcinoma. The etiology of this disease in the mouth is still unclear. They present as flat, multiple, graded or uneven coloration, irregular borders, and sometimes ulcerated. They are usually asymptomatic. Treatment. Surgery is the treatment for malignant melanoma. Under general anesthesia, the pigmented lesions were widely excised with clean surgical margins. Patient is kept on follow-up visits of 3 months. Radiation and chemotherapy may be used in advanced cases. And thank you.